Okay, well, it is 5 minutes after the hour. And as I promised, we would get started at this particular time. First, let me say thank you so very much for joining us. We seem to have some great participation. The numbers are looking wonderful. There's a lot that I know you all had to do with your day, so we are most appreciative that you joined us. My name is Jewel Daniels Radford. I am the president of the Jamaica Alumnae Chapter of Delta Sigma Theta Sorority Incorporated. Also, our vice president, April S. Morgan, is with us. April, wave and say hello so that they can see you. Wonderful. Our country coordinator, Sheila McKeithen, has also joined us. And Sheila McKeithen, like I said, is our country coordinator, and our treasurer, Ilana Dixon, Dr. Ilana Dixon, has joined us for this day, and some other of our members throughout our sorority. So today is a really special day. As you all know, World AIDS Day was December the 1st, but the advocacy just continues, not starts, but it continues because it started before December 1st. That was just the day in which we all wanted to center and focus our minds on this issue of HIV and AIDS awareness. That is the full purpose of why we are here today. It is very important to our organization that we be a part of the global initiative to educate, empower, and support those who are living with HIV and AIDS, as well as do all that we can to be advocates of those who love them and are seeking to find ways to support them. So that's what today is all about. So we are so appreciative that you have chose to join us for today. A little bit about Delta Sigma Theta Sorority. So we have a really, really proud legacy of Delta Sigma Theta Sorority. We are an organization of college-educated women, and we have a commitment to the development of our members as well as to public service. In 1913, on January 13th, 22 amazing women founded our organization with this exact purpose. We are a sisterhood of over 200,000 women across the world, which is why we are here in Jamaica. In saying that, we have several chapters within our organization, within our sorority, and they are based throughout the world. As I said, our home, where we started, is in Washington, D.C. in the United States. We have expanded since then, and we are in Canada, Japan, Tokyo, and Okinawa, Germany, the Virgin Islands, Bermuda, Bahamas, the fabulous Jamaica, the Republic of Korea. Our sorority is founded on a 5-point programmatic thrust that has us focus on these particular issues: economic development, educational development, international awareness and involvement, physical and mental health, and of course, political awareness and involvement. This program falls under our initiative of international awareness and involvement. But here in Jamaica, on this lovely island where the Jamaica Alumnae Chapter is located, many of you know the expression that says, "We little but we talewa." And in Jamaica, that means we're small, but we are powerful. And I say that because our chapter consists of 12 members. However, of the 900, and actually now we've grown to over 1,000 chapters of Delta Sigma Theta Sorority Incorporated, they can run from 12 to over 1,000 members per chapter. So for us, our journey began on April 24th in 2004, where we had some women from Jamaica who started and charted our particular chapter. And that was done under the presidency of the Reverend Gwendolyn E. Boyd, the former president of the of Delta Sigma Theta Sorority. So for our chapter, it's very unique because we are focused on serving the entire 2.7 million people across the island. Does that mean we touch every person? No. What I mean by that is most chapters in our sorority are focused in certain cities, but for us, we have one chapter, so we stretch our arms from one end of the island to the other. So that's why we are so thankful that you are here with us to help us along this journey. In doing so, we have some incredible strategic partners. And throughout the years since we've established Cambridge Basic School, which is here in the West, we help them and they partner with us, as well as E for Life. And today you will see a member from E for Life, Joy Crawford, who is the co-founder. She will be facilitating our program today. Mary's Child, that works with teen mothers. The Montego Bay for Girls, that is also known as Melody House. That's here in the West. Then we also work with St. Jude's. And so as you can see, we really look to extend our reach as much as possible. So having an opportunity to facilitate a program like this is incredible. So again, we thank you for joining us and being a part of this initiative. Our speakers for today come from, again, around the globe. Well, we are here in Jamaica. When we were first faced with this pandemic, I know we all wondered, how in the world will we stay connected? What will we do? What will it look like? What will it feel like? Well, now we know, because we have been mighty successful in doing so. So our speakers for today, Joy Crawford is here in Jamaica, as well as Jamuki Patrick is here as well. And then two women who are part of our sisterhood join us from the United States. So we welcome them today, Miss Haywood, Tessie Washington Haywood, and Nakeitra Burse, who will be a part of our panel discussion. So I'm going to let them introduce themselves. And after introducing themselves, I will pose a question and Joy Crawford will moderate today's session. As we go throughout the session, I will just ask you to please keep your microphones on mute so that we can avoid any background noise, so we can stay focused on the content and conversation. There will be plenty of time for you to ask questions, I promise. I promise. So sit back, relax, and just lean into what they will share. These are some of the brightest minds to talk about this particular subject. So here we go. Joining us today, as I said, is Joy Crawford. Joy, would you please tell our participants and us all a little bit about yourself?
Okay, thank you so much, Jill. Um, I heard.
Yes.
Yes, good, excellent. So, my name is Joy Crawford, as was said, and 13 years ago, myself and Patricia Watson, another Jamaican here, who over the years since the 1980s when we had our first case, have been involved in the HIV response in different levels in terms of program designs, the early days of the research, developing the volunteer and counseling protocols here in Jamaica, doing developmental issues for um, international partners, the Ministry of Health, and so and civil society. So we were on the ground for a while. But one of the things that we noticed was that women in particular were not being placed at the front of the response. And in our relationship with the women that we were working with, we also recognized that women were carrying the burden of HIV in terms of when the men were dying in the early days, they were the ones who had the children, the whole issue of the socioeconomic impact of HIV on their lives, and of course, stigma and discrimination. And we decided that we wanted to do something for this particular population, as well as it's something that we wanted to do with our lives in general. So that gave birth to E for Life, with a focus on working with women and girls living with and affected by HIV and AIDS. However, about 2 years into the work, the women who we were involved with kept saying to us that the girl was being left behind. Girls were experiencing severe challenges, and in particular, the high level of teenage pregnancy and girls who were pregnant who were living with HIV and not being seen in the response. And so our focus became a little bit more targeted. So we are actually known for the to be the entity in the HIV response that focus solely and primarily on what's happening to the adolescent girl in the HIV response, the prevalence around her, the issues around her. And of course, then we recognize that if we had these many young women who were living with HIV, who were pregnant, and were not vertically transmitted, meaning they weren't born with HIV, then we had to address the issue of sexual violence and rape and incest. So um, our work pretty much respond to those issues. It's the adolescent girl in our country who is a teenage mom who would have been living or impacted by HIV and who is a survivor of childhood sexual violence and of course the whole umbrella of gender-based violence. So that's what we do. We provide services. We're into care and support. We do counseling. We do mentorship. We help them to be able to reintegrate into schools or pick up vocations. We look at the social needs, we look at the parenting issues. So just about anything that you can think of that would holistically impact this particular girl and this particular young woman is what E for Life responds to. I think the last thing I'll say about us is that we are very strong advocates around the policies and the laws that impact the work that we do and the lives of our clients. Hence, being at the front and center with our civil society partners as we address the issue of ending violence against women and girls and responding to HIV in a human rights framework. Thank you.
Excellent. Thank you so very much, Joy, for your commitment. Ms. Tessie Washington Haywood, would you please share with us a little bit about you?
Good morning. I am Tessie Haywood, and I am from Columbia, South Carolina, and I'm definitely glad to be joining you all this morning. And I work for the Wright Wellness Center, which is located in Columbia, South Carolina. And Columbia is also known as the Millings area in reference of where we are housed and serving individuals in the community of the Millings. We are an agency that provide HIV and STD testing, as well as Ryan White services as well. Our agency has been existing in the community for over 25 years, and we are a nonprofit agency. Many people look at us as a community-based organization, and some may even identify us as a service organization. In Columbia, we are centered in the downtown area, which make access to services that we provide us attainable for individuals to come and get tested. We also work with women and girls, and we have been working with them and also advocating for their rights, as well as we too have not had many services in the area of South Carolina that focus mainly on women. However, we ended up working with women to have a voice in the community of Columbia, or should I say the Midlands. So I'm definitely glad to be here. I am the program manager for Project PACT, which PACT stands for Personal Action Changes Things. And
Love that.
our program is actually funded by the Substance Abuse and Mental Health Services Administration. Some people know it as SAMHSA. So we're funded by the government to be able to provide services to individuals who are struggling with alcohol and other drugs. And so we definitely work with women who suffer with that, as well as all individuals. So I am definitely glad to be here with you all on this morning and looking forward to sharing with you more as to what we have done in our community through our agency with working with women.
Excellent, excellent. And I love the acronym. My goodness, that's very powerful. Very, very powerful. Ms. Nakeitra Burse, thank you so much for joining us.
Yeah, good morning. Good morning, everyone. And I would first like to say that, yes, I'm from Mississippi, Madison County, Mississippi, and I am representing Madison County, Mississippi Alumnae Chapter of Delta Sigma Theta today. So I'm very excited to be here for this conversation. My career has spanned the whole, I guess, gamut of reproductive health rights and justice. So earlier, I spent a big chunk of my career working in HIV prevention, treatment, care. And currently I've been doing a lot of work in I have a public health consulting company, Six Dimensions. And so much of the work that we've been doing is around maternal health. And so though I haven't been directly in HIV services over the last maybe year or so, I think there's a great intersection with maternal and child health and HIV. And I do some contractual work to help HIV prevention organizations build their capacity. And so I'm just really excited to be here today, and I hope that we can contribute some great things to the conversation.
Thank you very much, Soror. So I was waiting for this opportunity to share with you so that you can see the example of how Delta Sigma Theta Sorority works. These ladies are my sorors, and we are partnering with the Madison County Alumnae Chapter in facilitating today's program. So when we made the call for guest speakers for this event today, our sorors answered, as they always do. Thank you very much for joining us, and we appreciate the partnership. And then, ladies, we always need a gentleman in the room to hold it down and keep it balanced for us. So we have today Jamuki Patrick with us, who is with the Network of Seropositives. Mr. Patrick, please tell us a bit about you and your organization.
Hi, good morning, good afternoon, wherever you are in the world. Let me first start off by saying thank you for having me on your panel today and being a part of this initiative as we commemorate World AIDS Day and we talk about HIV-related issues affecting various populations such as women, girls, marginalized populations across the world who are impacted and affected by HIV and AIDS. So my name is Jamuki Patrick. I'm the Executive Director of a community-led /NGO/network organization here in Jamaica that works primarily with people living with and affected by HIV. We were established in 1996 by then a young man at the time, and probably still young if you ask him, Mr. Ainsley Reed, as the first Jamaican to come forward within the media to say he's HIV positive, for us to recognize and acknowledge the issues affecting people living with HIV in Jamaica. Since then, we are primarily an advocacy organization, so we do a lot of work around advocacy, supporting the community of people living with HIV. We're led by a board of directors who are people living with HIV, and over 80% of our staff are people living with HIV. We capacitate the community of people living with HIV using various curriculum modules so that they can understand what it means to be living with HIV, the various issues as it relates to that, in terms of treatment, in terms of adherence, in terms of dignity, in terms of the information and knowledge that they need to know about HIV as people living with HIV. We do also do a lot of work around stigma and discrimination, and in Jamaica especially, HIV-related discrimination is still a huge problem and a huge issue as it relates to accessing treatment and care services here. And so we do a lot of sensitization with the general public, sensitization with the community of people living with HIV as well, so that they can know how to navigate spaces, so that they can know what to do in circumstances, because we want them to feel empowered. We want them to continue to thrive as people living with HIV, to stay on their medication and become empowered and feel as if it's worthwhile to live and to exist within a society where we all want everybody to feel comfortable and okay as individuals first and foremost. So we are part of the largest civil society response here in Jamaica. I would say we are a brother sister organization of E for Life, an organization that we support, that we work with, and that we have witnessed their growth in terms of since when they have started to where they are now. And commendation to Joy and Patricia Watson for that awesome idea they had at the time. Looking at issues affecting women and girls is something that we continue not to do here in Jamaica. And we still see women, based on our patriarchal viewpoints, as mere secondhand. And so we don't do a lot of work for women. And that's a great work that they're doing, and we support that work as well. And even within our program at JN Plus, we ensure that there is a gender balance to it. We are targeting women who are vulnerable, young girls, as well as in terms of their mothers living with HIV and the impact of that, looking at marginalized population as well. So the gender dimension is very important in our work. So I'm happy to be here today so we can have a conversation about this around this time of World AIDS Day when we look at global solidarity, shared responsibility. So thank you.
Thank you very much, Mr. Patrick. Well, on to our conversation. We will spend about an hour with this discussion and then open it to questions. So I'm going to hand this off to Joy. Joy, please.
Thank you so much, Jules. And thank you again for everybody coming in. I'm very excited about this conversation. I like the theme, smart women, healthy choices. And I want to start there with my panelists, just to get an idea of how you felt and what does that theme mean to you. And then we're going to get some more into some of the real issues. So why don't I start with Jumoki? You're asked to come on a panel to talk about smart women, healthy choices. What's that about for you?
All right. So I love to be a part of conversation with women. I love to be a part of conversation when we're talking about gender-related issues. And for me, especially as somebody who grew up in rural Jamaica, grew up with my grandmother as my backbone at the time, and my mother and my aunt and those persons, for me, reflecting, talking about, and having conversations related to femininity or women and girls are very important for me. So with whatever lens we're talking about, HIV, any other developmental issues, I'm excited about it because that's where I learned as a man. And I have to acknowledge that as a man, I am privileged already based on the structural setup of this world. When we look at patriarchy, when we look at masculinity, when we look across various countries and who are the leaders, the men are in charge. And so for me, whatever space I can be in or whatever space I can create and curate for women to express and share and to be empowered and uplift, I'm happy to be a part of it. So don't feel as if because I'm the only man on the panel, that I'm intimidated. I'm actually happy and excited to have the conversations and to hear the different viewpoints.
I love it. I love it. So this is a smart man making healthy choices among a bunch of very smart and talented and powerful women. Thank you for sharing that. And I like the fact that you shared that you had women in your life, strong women who allowed you to be able to have these set of values. Thank you for sharing that, Jumoki. So let me hear now from um, Tessie. I mean, what was this about for you? Smart woman, healthy choices.
So I definitely was excited to hear the title, Smart Women, Healthy Choices. For me, I pretty much thought of it in the realm of we often encourage women to be healthy weight wise, or whether it be mental health. So, physical and mental health, we often talk about that as it relates to healthy choices and being smart about those choices when we're making them. And I just think also the importance of being smart as it relates to when we're engaging in intimacy, how we can make healthy choices there as well. So being able to really educate women as it relates to how they can go about being smart and being healthy when they're engaging in such an intimate time.
Very good. Thank you. So I'm hearing that it's smart choices to be healthy, eh?
It is.
Excellent. Definitely. Thank you. Um, Nakeitra, smart woman, healthy choices.
Yeah, so I want to add a little on to what Jamoki said. He talked about the structure that we live in and that men are often the leaders. And I want to add that the women are the leaders, but we are leading from behind, and we are creating the strategies, we're creating the talking points, and we are lifting up those men who are leaders. And so when we talk about smart women, it definitely takes our knowledge, our brain power to run these structures that we live in. And so then the other pushback there is that when we live in these structures and we talk about healthy choices, it's often we hear a lot about personal responsibility and what we should do to be healthy. But we have to navigate these systems that aren't always, or none of them are really set up for us to really be healthy. And so when we think about making healthy choices, it's a little bit harder. And so I've learned in this work to give grace to us as women and to give grace to us as just humans, because it's hard to make those decisions, those healthy choices, when we have all of these additional factors, whether it's family or lack of access to health care or some other determinant of health. And so I think Smart Women Healthy Choices is a great thing. I also think that it's very complex in a way, because we have to learn how to navigate our intellect to be able to make the healthy choices for ourselves and our family.
Okay, good, great. Thank you so much. That's a fantastic start to our conversation. I just want to remind the audience that as we move forward, the chat is there that you could write your questions and your comments. I don't want you to forget anything. Not jot on a piece of paper, because in a short while we're going to open to take questions from the floor. And also, feel free to start making your points in terms of what you may want to contribute to. I may just switch from the panel and pick someone on the floor as spirit leads, just to get your feeling on stuff that you're hearing. So be ready, be fully engaged. As we like to say, we want full participation. All right, everybody participating. The other thing I want to say before we go further is that whenever we have a conversation around HIV or sexual violence or gender based, it can be a very emotive time. So know that you are in a safe space, but be aware that if you could be triggered, you may find that you stuff that are said are personal, that you can relate to it. We encourage you, don't leave the room. Just send something in the chat to say somebody need to step off and just have a conversation with you. We don't want you to leave without support for whatever may be happening. So, be aware that this can happen, but we're here for you. And just make a little note. If you're in the chat, there's actually a section that you can send a private note. So you click on the private section and you send to Joel, and then she can translate to us. I need some support. I need to step away. And this is what's happening to me. So I know in this space and within the sorority, you have persons. I see Reverend Sheila is on there, who can support you in this conversation. So I just want to put that out there. This is a time for us to have a conversation, a real conversation, but it's also a time for us to get involved beyond just what we know intellectually, but emotionally and otherwise. So at the end of this conversation, we can definitely demonstrate some changes for self, for our community, for our countries, as far as it concerns this. Deal? Deal. Very good. All right, so I want to lead the difficult conversation around HIV off with Jamoki. Especially in the Jamaican context, I'd like you to share with us, Jamoki, what really is happening in Jamaica in 2020? What is the data saying? Are there any particular areas that we need to be very concerned about? And in particular, as we started to talk about, how are our women faring out, our women and our girls and our children? What can you share with us?
All right. So in terms of data, we are seeing less AIDS-related deaths. For the last 4 or 5 years, we have been seeing the numbers going down in terms of people because of AIDS-related complications. So that's a good thing as a country and also a Caribbean region when we look at the data. So when we look at the treatment cascade, where we're supposed to reach 90, 90, 90, which are the global targets, Jamaica is averaging around 80 something percent as in terms of the amount of persons that know that they're HIV positive. Where we fall off is those that know that they're HIV positive, that are in care and that are virally suppressed. So I think we're at 50 something percentage of those that are HIV positive that are in care or accessing care. And we're also doing poorly as it relates to viral suppression on detectable level. So when we look at the 390s, the last two is where we're having major challenges with. And when you examine that some more, especially for the last two, it has a lot to do with structural issues and an enabling environment issue, discrimination, not paying more attention to key and vulnerable populations such as women and girls, not paying attention to key and affected populations such as the LGBT population, sex worker. And because of the lack of attention to those populations, communities, however we want to classify them as, we're still having those problems. So even if I'm HIV positive or I did an HIV test and get the result, I'm unwilling and I will not go to a healthcare facility because of fear of disclosure, privacy, the confidentiality issue, the discrimination issue. And then when our girls and our women even find the courage to go into these facilities, they are judged, they are discriminated against. They instead of being treated, they are assessed against spiritual and moral principles or the Bible. And because of that, they don't go back. And it's the same thing for other key and affected populations as well. And so we are falling short as a country where those main issues are concerned. We're not having a lot of conversations with women and girls. We're not having a lot of forums and spaces for women and girls, LGBT population, sex workers to share and communicate. And the civil society organizations that are doing a lot of these type of work and can speak out more as it relates to these issues don't have the resources, whether financially or the technical or capacity in terms to do this type of work. So it continues to be something on the back burner where HIV is concerned in Jamaica. I do give credit to the government that HIV medication is free and is accessible across the island. But if the spaces where these are located and where these are available are not supportive, are not easily accessible, we're going to continuously have these problems where our key and affected populations will not access them, will not take up the services because of fear of whatever that exists. And so that's where we have a problem here in Jamaica.
Okay, wow, thank you, Jamoki. And that leads me straight over to Tessie, who is he spoke about spaces, um, safe spaces for people actually to access treatment and care. Tell us a little bit more about what is it that you do? What is your experience in your entity? You mentioned about the rights. Is it Wayne Wright, I think you said? Tell us about your program. How does your program create the space and the access for people to access your treatment? How is that going? And is your experience same to that of what Jamoki shared?
Yes, actually it is. Just thinking about some of the things that Jamoki has shared with us this far, we experience some of the same barriers in Columbia, South Carolina, also known as the Midlands. For our particular program, as it relates to the Wright Wellness Center, we have testing as well for individuals who come there. And in reference to treatment, we have a doctor on staff who provides treatment services, and we have where we link people to other services. Let me say this in reference to our services for women. We in Columbia, we too suffer with having additional resources for women sometimes, whereas y'all excuse me, I'm definitely excited to share with you all on today. And just with our particular program in Columbia, we have the right, I want to keep saying right, so I do apologize, but Ryan White Services.
Ryan, okay. Mm-hmm.
Yeah, we have Ryan White Services case managers there, and we have them to be able to serve our women who are coming in who are positive. We have in in Columbia, we have 4 AIDS services organizations, so they do have the ability to go to different providers. In our particular setting, when we identify a woman who is positive, we definitely try to link them to other resources for medical, as well as for the alcohol and drug services, other supported services that I think we have talked about this far, that have been mentioned. So for our numbers in the Midlands area, for 2017 through 2018, we had 485 persons were newly diagnosed with HIV. And for that percentage of women, women were actually at 21% were diagnosis from that diagnosis in the Midlands. So we definitely are looking at how we link them to care, how we support them. Majority of them don't always have that support system where they too can be able to lean on one another. So we as an agency have been able to identify those support groups. The women have actually pushed us to be able to actually do those support groups. So one of those support groups that we actually were able to identify one time was Positive Voices. And with Positive Voices, that was actually channeled by the women who were living with HIV and who said that they didn't have a voice in the community and who really wanted to be able to show that support amongst each other. And so that's what we did as an agency, to be able to be that platform, to be able to be that support system for them and for their families, because many of them who are newly diagnosed, it's a scary moment for them. And some of them are not willing to share at that time and don't know how to share at that time. So hopefully, we definitely have been working very closely with the women. And I do want to share, as we move forward, other activities that we have been able to do with our health department and working with the women.
Sure, great. Thanks for sharing that. And we'll definitely come back to that as we look at strategies. Nakeitra, as I listened to both Jamoki and Tessie, and they spoke about women in general, I can't help but thinking about the issue about gender. And in your opening, you spoke a lot about understanding the challenges that makes women so vulnerable. And you mentioned the fact that behind the men are smart but silent women, pretty much. And this invisibility or the struggle for women, it sounds as though we may be saying that it is okay for women to know that they're doing what they should do even though they're behind there. Or we could be saying that no, we want to see a space where women are actually at the forefront. So this gender conversation keeps coming up. And often here in Jamaica, I ask the question of my colleagues, are women being treated different than men in the HIV response? And often I hear yes. So in Jamaica, for example, when a man gets a positive diagnosis, the society has two reactions. Either he is a gay man and he deserves to get it, or he's a poor, unfortunate man that a wicked woman infected, and we're sorry for him. When the woman is infected, it is same. She's a slut. She did it by herself. She's promiscuous. What did she do? And so those two stark differences we see. And so I heard positive women say to me that they even go to the health center. And when the men come in, the nurses are so excited that he's there. Yes, the man showed up. He's treated with a little bit more preference. And the women are sitting there for hours, And so even though we know that men may not have the same health-seeking behaviors, the women are feeling like we are really lost in this process. In relationships, for example, with the girls that we work with, there is a demand from the male partner to know their status. They want to know the results. But for some reason, the young women don't seem to have the same desire. You ask them, do you know your partner's status? No. Have you ever asked him? No. Do you want to know? No. So there seems to be a gender inequality even within the HIV context. What do you say about this? What can you share with us about this? And what are we actually seeing?
Yeah, I think you're absolutely correct. And as everyone has been talking, I've just been kind of jotting down the similarities. The same things are happening specifically here in Mississippi when you think about being in the deep, deep South and in the Bible Belt, and even, in the Black community specifically. We already don't talk as much about health issues in our family as we should. And so then when you compound something like HIV that still carries a very heavy stigma here in Mississippi, then it makes it personally, it makes a woman, fearful of going to find out the results, fearful of even Googling, where do I find results, and or find testing and care. And so when I was doing a lot of work in HIV testing and prevention, I saw that as well. Our organization had 10 to 17 interventions and activities that were specifically for Black gay men, but 2 interventions for women. And I know much of that when, look at CDC data and the way that CDC pushes interventions out, much of that, goes along with the data. But when you look at how, women are treated, and then when you look at the data, it still shows that, yeah, heterosexual contact is how women are acquiring HIV, specifically here, in the South. And so I can remember even working in the clinic, and of course, for every probably 30 men that come in, it may be one woman, but we know that the women are out there, but our efforts were never targeted in that way. And, and I think funding has, and we may not talk about that much, but the direction of funding has really kind of drawn that wedge as well, because when you look at the funding announcements, they all say
Yes,
target for Black gay men. And
that's right.
so when you get that one announcement that says for Black women, then everyone's trying to, to get to it. And so then that one big organization gets it. And, how many people are actually served in that way. And so I think it is about the structure and the setup, which of course follows along the data, but I think we just have to look a little bit deeper at the actual issues that women are facing with access, reproductive rights and justice. And if if I test positive, what are my options if I do want to have a family? And those are the conversations that I have not seen be pushed to the forefront, especially regarding women. I can remember going out and doing testing events on college campuses, and we have, everyone coming to get tested, but the focus was never on those women. And so I can remember being in counseling saying, oh, she needs more, but the focus was never that way. So I do agree with what everyone is saying. Women are almost really pushed to the back burner, and we're sometimes just forced to kind of figure out how to deal with things, because we figure it out. But I really hope that, funding continues to go in the direction, because we're seeing the movement, we're seeing the numbers, on the downward trend. So something is working, but I think it's more about the conversations that we're able to have within our social networks, and how we continue to normalize the fact that, well, even if I'm a sex worker, I still am afforded. I don't care what you think about that. I'm afforded the care that I need. And so I think we need to destigmatize a lot of the conversations that we have.
Thank you.
And may I piggyback on that too?
Go ahead, Tessie.
Thank you so much, Joy. That is true for us in South Carolina as it relates to, when we were doing testing in the community as well. And for funding for our area as well. We in South Carolina, we in the Bible Belt area, and being in that Bible Belt area, most of our funding too is identified for more so men. And so I agree, when you see that money out there that is advocating for women, how you can serve women better, yes, people do jump on it as well. Same thing here in South Carolina or in South Carolina, yes. So I agree in reference to us having that same issue with more money being focused from CDC or other federal government agencies focused on the target population for us being African American and men who have sex with men. So yes.
Please
Thank
explain
you
what
for
you mean
sharing
by
that.
Bible Belt, because all of our listeners may not understand.
Oh, the Bible Belt. Well, most people see it as, being the Bible Belt as religion playing a big part in the fact of persons' ideals around sexual intercourse or being tested, and putting that stigma on people as it relates to their 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 practice and what they do. So a lot of people will see that as a state that's very judgmental
All
per
right.
the Bible
Yeah.
Belt.
Thank you for sharing that. It's exciting in a anxious way as I listen to what you're saying because we have the theme of global solidarity for World AIDS Day, and I'm hearing this global solidarity when it comes to not having dedicated funding for women. And I thank Jamoki for sharing at the beginning about the work that E4Life has done, and has he watched and respect the work, because that's been a major challenge for us. We probably are the one NGO in Jamaica that's not working with other populations. So funding has been always been a major challenge for us from the donors, because like you say, the keep ups have never included women and girls. And so I'm not really comforted, but it's good to hear that I am not hallucinating. But it really is a challenge overall in the HIV national response and globally, that women really need now to be placed for dedicated funds at the center along with other key populations. So I thank you for sharing that. But I'm going to switch the conversation a little to something I've seen in the chat, a question, and I've heard it. And I'm posing this. I think I may have another male on, or somebody's using his picture. Um, but it's about the conversation around sex and how us as women and in communities of women have this conversation about sexual health for women, and not just HIV. It's about how do we, when we get together, not just talk about Lord, the man them pressure me and how worthless they are, or Lord, my life is bad as a woman, and all the things that we do, but to talk about how do we help each other to maintain good sexual health. Um, are we having conversations about what's happening in our menopausal years? Are we checking up on each other? Have you had your mammogram and your pap smear done? Have you have an HIV test done? Have you had the conversation with your partner? Because one of the things that I find is that the young women and women who are living with HIV seem paralyzed to have that conversation. And they weren't having the conversation before HIV came in. So it's very more difficult for them to have it now. But how can we help each other to destigmatize and demoralizing? I don't think there's such a word, but you know what I mean. We have to take the conversation around sex outside of this religious morality, recognizing that it is the one avenue that really put women under pressure, and especially in HIV. Nobody wants to disclose to their partner. Nobody wants to say, this is what's happening to me. Just last week, I was with a group of community women, and one woman stated very clearly that she doesn't think that women living with HIV should be having sex at all, and that they are irresponsible. And actually, the word she used was wicked to even try to have a child. So the whole issue around women's sexual health, women's sexual reproductive rights seem to be so linked into HIV, and of course in terms of stigma. So I'm putting this to any of the three of you. What are your thoughts on this? What is happening to our women, and why is it that there seems to be this constant oppression when it comes to women's sexual health, their bodies, their rights, and in terms of HIV? What are your thoughts on this?
I'll say I think we've made some headway, and I'll say that particularly in the South, one thing that I think helped a lot was, or has been helping and should continue to help, is adding HIV testing as a part of routine care. And so it's not when I go in for my annual exam, do you want an HIV test? And that, because that continues to put it down like as this stigma related issue. But when clinics or healthcare providers just add HIV testing as a part of standard care, I think that just kind of makes it more normal. But also we have to be comfortable with our bodies, and we're not always just comfortable, because mom didn't talk to me about sex, and I learned from my friends, and I don't know what I should be doing. I'm not supposed to have sex before marriage, but I have these feelings, so I really want to have sex. So I think it's about like in our social networks, and some of these interventions do it, but they're in such a very concentrated community that it just doesn't get spread out to everyone. And so just being able to, number one, teach us about our bodies and get comfortable talking about our bodies, so that when something isn't right, we don't feel ashamed, or there was something that I did wrong when something doesn't feel right. So to me, it's more about making that conversation and understanding our bodies. I can remember doing trainings where our first thing was, okay, let's just show the woman's reproductive system. And there, were many women in the room that were like, I have that here, and those are just conversations we have not had, and they're very important. And I think it just needs to be a part of regular education, and not like putting it off to the side as you go into this dark room and learn about sex. No, it just needs to be a part of our general conversation.
Yeah, thank you for sharing, because I do think if women and men, but especially our women, were more sexually smart, then I think we'll be able to do a lot better in some of the challenges that we have, as far as the concern. One, sticking and honing our human rights to our bodies, and not thinking that we are objects, um, of the sexual violations that occur. So thank you for sharing that. I want to
Right.
go to, go ahead, Jamoki. Yes, sir.
Right. I wanted to add to that from an observatory point of view.
I hope
Where
so.
in general, in general, and I want to contextualize it here in Jamaica when it comes to sex, women's health and their sexuality and their rights, and sex in general. Let me start there. It's a taboo, and so we don't, like she said earlier, we don't have the spaces where the personal become the political, where more women are talking about period or menstruation or sex or their bodies or their breasts. And so we restrict it to the homes, and even within the homes, the mothers or the daughters or the family in general is not even sharing with their sons and daughters what to do, what not to do, those type of conversations. And so we grow up, because I remember not having a conversation with anybody about sex until I reached university. And for me, that's when I started to explore it. For me, that's when I wanted to know more outside of what I heard my friends saying, because I wanted to feel it, I wanted to touch it, I wanted to do that type of thing. And when we have young people, women and girls, whomever, at that stage when they're exploring, the risk happened there, the mistakes happen there, and unfortunately for some persons, they end up down a path where it's no longer something that it's something they regret. And so from as early, how do we curate and within the homes and the communities and even the churches talk about sexual health, talk about health across the board for women especially? Because if we don't start doing that, women especially are going to feel restricted in what they say about their bodies, how they feel about sex and sexuality, even just saying what I like versus what I don't like, because that also complicates issues around sexuality, and why people who are from the LGBT population are afraid to disclose this as well, because we don't have a space in general for people to share that open.
Thank you. I
And
mean,
this
there's
is
so
Tessie.
much to discuss, but we're going to I want to be able to go to the audience very soon.
Mhm.
But it's important. The reason why I bring this thing up about sex is because, so many, especially in this, when it comes to stigma, because HIV primarily, and I heard it, is transmitted through sex. For some reason, all the interventions, all the reactions of people comes from a judgment of somebody went and had bad sex with bad people, or you had sex so you got what you deserved, or and so that piece of it makes it so complicated. And we can't leave it out of the conversation, but we're not going to unpack it everything today. I want to thank my panelists so far for what I've heard. I'm going to have one more issue, and then I'm going to go to my audience. I have seen some in the chat. Is the issue of young people here in Jamaica? We know that young people, and internationally, is saying the young person who is HIV positive is less likely to maintain adherence, especially those that were born with HIV. When they get into their teen years, we start having problems with them. We can no longer tell them that they're having Smarties or vitamins. They are now questioning, why am I on this medication? We have a whole lot of the kids, especially here in Jamaica, who don't know their status. And we have been seeing in E4Life in the last 2 years in particular, what we call the discordant couples. So here's it that I have this young girl. She's gone to the health center. She's pregnant, and then she tests positive for HIV, but her partner is negative. And we would see that sometimes when they have more than one partners. However, when we see that now in the young girl, where the partner is the first sexual partner, then the question comes up. Then you hear from the families, oh, her mother died, but we didn't tell her anything. Or, oh, we knew she was positive, but she was so young, we didn't know what to tell her. So we have a number of our young people who are growing up. In 2016, I think, there was a report that was done by World Learning that said we had over 10,000 children born with HIV. And if they're not in care now, where are they? What are we going to do for our young people? We also, in our data in Jamaica, is saying that condom use is down, bad practices are up in young people. We're hearing that age 15 to 25 are the highest risk group. Our young people, who we say are our future, are a major, major risk if we don't fix some of these issues around not talking about sex, reducing stigma and discrimination, creating safe space for them to come in. To my panelists, one of two of you, what are your thoughts on what's happening to our young people, and what can we do? And then we're going to come back and we're going to go to get some comments and questions from our audience. Young people, what are we going to do? What is happening to them as far as it concerns HIV and their future? Who wants to go first?
I was trying to defer to Tessie. I thought.
Okay, thank you. Well, for us, one thing that we have been able to do per our agency is be able to partner with faith-based communities. And in partnering with those faith-based communities, we have been able to have the conversation of educating the youth per those church youth programs. We have been able to go in there and actually be able to educate them about their reproductive system for young girls, have the conversation, the open discussion. We have been able to have those platforms. Also, we have been able to work closely with some of the schools in our area, where with some schools, of course, we are limited in what we can say at those particular venues. And we invite them to our community outreach activities that we have per our agency. And also if we're doing things in conjunction with the faith-based community, so that we can be able to have that open dialogue more freely with the youth. Of course, we have the education piece as it relates to condoms, as it relates to how to have a discussion with their partners in reference to using a condom. And then the curiosity. Many youth, of course, have curiosity. And like someone else said earlier, that they tend to find out from their friends or hear from their friends. They get misinformation. So we do our best when we're doing community outreach events to educate them as much as possible. And I will say, per the state of South Carolina, our agency have been able to actually have that faith-based community where we were actually able to obtain some monies to be able to work and go in and do more with different faith-based communities in our area. So not just one, not just one church, but multiple churches.
I like that. And so I'm hearing that the faith-based community is on board in your area, and that is a major, because one of the things that we see is the place that young people are least supervised are at youth camps and church functions, because in those spaces nothing is supposed to happen. But we know that's not quite true. So it's very, very good to hear that the churches are on board.
And Joy, may I add one more thing, since I'm getting a little bit comfortable now?
Go ahead.
May I add one more thing? In reference to Delta, I am a part of the Orangeburg Alumnae Chapter, and that's in Orangeburg County. And we do have a youth initiative program called Delta Gyms and Academy. And because of the work that I do, I know how important it is to have that open dialogue of education prevention as it relates to sharing information with the youth. So we had a session with the parents, the mothers, a chat and chew session where the parents were having that open dialogue with their daughters about intimacy, sex, and one parent who actually is a soror made reference that was helpful for her because she and her mother never had the conversation, as well as it was helpful for her to have that open dialogue with her daughter.
Excellent, thank you. And that's like we have a program in Equal Life called SMART. And SMART is sexually alert, SMART, responsible teens, I think, something like that. But we actually have a conversation with the girls and their parents in a similar program. So thanks for sharing that. There's a question for Jumoke, but I'm going to hold it. And I noticed that, is it Ileana Dixon?
Hi.
I noticed you've been writing a lot. It sounds like you have a lot to say to us. So I'm going to give you a minute just to share with us your thoughts. And I hear you're a pediatrician.
Yes, you don't remember meeting me? We had a Zoom meeting a few months ago.
But I remember the profession, right? So
yeah,
tell us.
So I just want to start by saying thank you so much for this opportunity, and thank you for giving me a few minutes to just review. I have a lot of questions. I have a lot of comments, actually. So I am a pediatrician. I'm a very strong child advocate. I'm also a big advocate as it relates to maternal health, because I don't believe that we can even start with children until we address the concerns and the issues that are affecting our mothers in the community, especially in this case for this discussion about today is the HIV positive moms. So I'm going to just start with one thing, in that the women that all women, any woman that goes to the clinic to find out she's pregnant gets then pushed to do this prenatal care thing wherever. She can do it at a clinic, she can do it at a UE. She has those choices. It depends on when she goes in. But these women are then vilified. Like, they don't come to me, okay? They go to another clinic, a special clinic. They have a special name, like Section 13 or something. And I have seen one or two in the past 3 years that have I think just one that has disclosed her status to me. And she did that really only because she didn't want the father of the baby to know that she was there. Like, she had all this angst about that. And so she was like, I'm Section 13. And I'm like, what's Section 13? That's what it is, Mrs. Crawford, right?
C13, yes.
C13, sorry. So, so that's one. I feel like they're vilified from day one. It's like you're HIV positive, and they put like this big scarlet letter on you, and then you have to like carry that around, and then you carry it around when you go to the hospital and have your baby. I'm sure everybody's wearing all these masks and these face shields. This is before COVID. I've seen how obstetricians have delivered HIV positive babies, or moms, the babies from those HIV positive moms. It's not. It just is so, it's just not something I ever want to see again. I also just wanted to touch on the things that like we can do, okay? And for one, we talked about intimacy. I think it's really, and this religious thing, I think it's so important to not only educate our girls, but educate their parents, including the fathers, that it's okay to talk about this. It's okay to unpack this stuff and not make it taboo. The other thing that I find as a pediatrician that's very, very challenging is that the parents don't want me to talk about it with the children. So they're just like right up front saying, And when I have a sexually active teen who has disclosed that to me in front of or not their parent, my first thing is we got to get a panel of STI tests going on here. And when the parents find out, they're like, oh, you know, they're okay with everything except why are we doing HIV? I'm like, because everybody's HIV positive until proven otherwise. Or why are we doing a pregnancy test? Because your child is a female and she gets her period. So that is a big thing. And then just to talk about intimacy, to help these young gals and young women, not just the gals, but help them understand that when they make that choice to become intimate in whatever setting it is, there are like these consequences that are not necessarily bad, but you have to talk about like how important this thing is, you know, like how significant that choice is, not how bad it is, but how much it really affects you and your person. And then you go on to ways that you can protect yourself, whether that be with a condom or with the birth control pill or with abstinence. I don't really think abstinence works. I think we have a lot of studies that show that. I mean, I think that it would be great to do that, but I just think that we need to, like, as a pediatrician, what I do is I don't vilify anything. I say, listen, are you sexually active? Are you like waiting till you get married or that sort of thing? And I just tell them like, it's a big deal. Okay. So whether or not you choose to wait or not, you know, let's talk about ways that you can protect yourself. Let's talk about how I really care about you and your health and not your parents. I mean, no offense. And how, you know, if you want to abstain, that's great. But guess what? If you don't, right, I'm not going to judge you. You can still come back to me and admit that. And guess what else? If you don't, okay, you can also protect yourself throughout that entire process. So that I think is like kind of the crux of what I wanted to say. Thank you for letting me talk.
And thank you for sharing. And it's very crucial. I don't know what they experience in the US, but here in Jamaica, we do have challenges based on our laws and policies when it comes to providing.
I practice in Jamaica, by the way.
Yes, providing information and commodities to young people. So there is a challenge around how can practitioners give the information, how can they give service. In situations, for example, where the families are not supportive, where the perpetrator who may be in the families, we have situations where sometimes when the girls are pregnant, the mothers and the families are the shame and you bring disgrace on us, do not support them in accessing services. And because they are minors, they can't do it on their own. So that's a major complexity for us. One of the things we talk about, for example, is the 15-year-old mother. She's still under 18 and of her own, even though she's a mother, she can't go into some of the social services and write up for benefits for her and her child. So we do have issues around how we're able to provide access and services. And so we're very grateful for physicians like Dr. Dixon, who And a lot of them are saying, listen, we know that we don't have protection under law for some things, but we're going to do our work nevertheless. I remember one of my colleagues said he's going to provide the services that are necessary for our young people and let the Privy Council throw it out, if he's charged. But we do need to have changes in our laws to protect physicians and care workers so that they can actually provide the necessary services for our young people. So thank you for sharing that. I'm going to go back to my questions. I see where there was one question that was asked about can civil society organizations provide medication. At the moment in Jamaica, we have only Jamaica AIDS Support Life that has a treatment center, which means that they are able to provide medications on site. The other entities provide the care and support. So what you will find is that the staff and the peer navigators in those entities will support the client, for example, by picking up their medication at some of the pharmacies and taking it to them where they can't access it. Especially during the time of COVID, there was a lot of that had to go on where clients were, shut down or weren't very mobile or didn't have the resources to come out. Then the staff would go and pick up for them and take it to them. The HIV civil society community also support people taking their medication. So people who are not adherent, we will give them follow-up calls. We will do pill counts just to ensure that they are on their medication. But only Jamaica is a Forest for Life at this time has a treatment, is considered a treatment site based on the investment and the capacity. So they have a pharmacy there. They have been able to employ full-time doctors to be there. That is what is required for the other groups like a JN Plus and an E for Life. There's nothing that's limiting us from doing those, but to have the resources to make sure that there are more NGOs who can actually do that. So I think that question came from Reverend Sheila. There's also a question here for Jamoki specifically. And I think the question was asking about what are your thoughts, Jamoki, and how can you help women to talk to their partners about their status? I guess especially in terms of, we know that there's violence sometimes, that's a part of the deterrent. And so what are the suggestions? What does your organization, for example, advise women as to some of the strategies that they can use? And how do you support women in disclosure?
Thanks for that question. Wow. There's no textbook explanation or definition as to how you should do this. So it's not one size fits all because circumstances are different for different women based on how empowered they are, based on their socioeconomic background and education. And so there are a lot of factors that will influence that. What we at JNPOS try to do, especially when we are doing our gender-specific support groups or sessions with women, talking about intimate partner violence and gender-based violence, is to first assess your situation. You know your partner, you know the person you're in a relationship, but you need to assess what type of person this person is before you decide to divulge such an information to them. I mean, definitely talking about sex, talking about doing an HIV test with your partner is very important and critical because of what it means. But when we look at our situation here locally and we understand the context when it comes to the various issues such as gender-based violence and intimate partner violence, the first thing we say, you need to assess your situation. You need to assess who you are. What does this mean for you? When you share this to this person, what would be the repercussion? Would it end up in a violent situation or violence? Or would they be more understanding? Because you don't want it to be a situation where they disclose and then they're kicked out of their homes, their communities, they're displaced, and they have nowhere else to go. So we consider those various issues when we talk to women about these. And in our local, we don't have the resources in terms of providing safe spaces for women and girls who are displaced or are experiencing gender-based violence. We've been talking about it for years in this country, about setting up homes and spaces for women where they can go to should they be kicked out of their homes and their communities. But we're not there as yet. And so women still feel as if they can't share this information with their partner because they don't know what else will happen. So there's, for me personally, guys, there's no one way about it. But what I will say is, it should always be important for a woman to talk about their partner, about safe sex, about sex in general, and about taking an HIV test. How they feel about themselves, how they value themselves, and what is important for them. We do understand the issues of power. We do understand the issues of being uneducated, don't having the resources or the money to take care of yourself, and you're depending on the man for these things. And so if I say this to him, I may end up losing these things. I may end up losing the children. I may end up losing the home. And so it's a very tricky situation in our context. And in other parts of the world, it may be easier. But when we look at what happens to women here, especially women living with HIV, especially when we look at gender-based violence and intimate partner violence, we are very careful in the recommendations that we give. We do build the capacity of women, though, to understand issues around sex, understand issues around HIV and the various characteristics or offshoot issues. But at the end of the day, it's a personal decision based on these recommendations and guidance that we give. And I do believe Pat and Joy probably could talk some more about that, because they have been directly working with these particular, with women who are seriously affected by trying to share or disclose their HIV status with their partners.
Thank you, Jumoke. I know Pat is online. I don't know if she's available to respond to that, as to how E4Life addresses the issue of disclosure. Is she there? Well, her photograph is there. Pat, are you with us? All right. Okay, there she is.
Hi, Joy. I stepped away a moment. Can you?
That's all right. So
repeat the question, please.
How does E4Life address the issue around disclosure? How do we help the women and the young, and what are some of the, strategies or advice about persons being able to disclose HIV status?
Okay. So one of the things that when we started working with the young women way back in 2008, we made a commitment that based on our own experiences, you have to be able to know self, understand self, and based on that understanding of who you are, we start with what we call a program that we call self-discovery, and through that process, we lead the young women through a process of understanding the trauma that they experienced even prior to HIV. Mm-hmm. And we also lead them through understanding and dealing with the issues as it relates to HIV and what it means to them. We believe that if the individual doesn't understand and know herself as being a unique individual, as being divine, as being, placed here in this world for a reason. And even though HIV is not a good thing, but you can make, I'm trying to remember the phrase that my mother used to use, but you can live your life to the fullest, despite the fact that you have this disease. So that's the first thing you have to start with the woman. Once they understand that, once they're able to deal with their own feelings, to deal with the self-stigma, the discrimination that comes with it. Once they're comfortable with self, then that's when they get the impetus to say to hell with all of you. I am HIV positive and I can live. I am a wonderful woman that was created by spirit for a reason, and I am here, and I'm going to be here in your face as long as I want to be. So what we do is really to build that self-esteem, to build the courage within these women to know that they are divine, they are good, they are everything that you want to be. You can be anything you want to be. And we find that the women who buy into this idea that I am, they are the ones who we find disclose earlier than the others. So I think what for disclosure to take place, people have to come to terms with the disease. You have to start loving yourself so much so that you're able to deal with the stigma or the discrimination that comes with it. But I must say that one of the things that we also teach them is that people, even though people will say stuff and you know that they don't have the right to say it, you because you know yourself, because you know who you are, they also understand that if the law is broken, and if persons say things or do things to them, then they have a right to report it. So they will go to the police if you dismiss them from their jobs, if you don't allow them to the things that they are allowed to access as their own rights. If because you deny them of this, then they should be able to go and seek redress for this. These are not things that you just leave alone because you are so confident in yourself. But you, as an advocate, must go up forward and make sure that others are benefiting from those rights.
Thank you so
I
much,
hope I
Pat.
answered the question.
Yeah, so I'm hearing about the importance that if we don't deal with self-stigma, then the issue of disclosure is almost not going to happen, because whatever you hear, when you say to someone, you're going to take it onto yourself. And I'm hearing that when a woman is empowered and she is, standing her own truth, then she becomes an advocate for herself and for others. And therefore, she's be able to navigate some of the ills that may happen to her as a woman. Thank you for sharing that. Thank you, Jamoki, so much. And I want to wrap up my section before you hand it back over to Jules. And I think I went through the chats. I don't know if I missed any, but we're gonna take more questions from the audience. I think she's gonna have a section as well. But to my panelists, I want to thank you so much for the conversation and for being open and sharing. Your last words, your last thoughts. Smart women, healthy choices. In all that you've heard and all the cross-fertilization of information that we shared, what do we do now? What do we do as a bunch of women who are smart women who have made healthy choices to show up today for this discussion? How do we now continue it for ourselves, and how do we influence other communities of women? And we are not leaving out our men, but for this conversation, we're talking about how do we be there for each other. What do you say? What is your last sayings about this issue around HIV, global, what is it? Solidarity, shared
Right.
responsibility.
So I'll start and leave
Yes.
for the women to finish off and
There you
insight.
go. Smart man.
Um, smart women healthy choices. Women have been smart and making healthy decisions from time immemorial. What I do believe that I can be a part of and do more for women and girls is to, one, step back as a man and recognizing that I'm privileged in that capacity, and I'll allow the women to lead, to take charge of the different conversations and issues that especially affect them, and don't feel as if I need to always have a voice in their decisions, in what they have to say for themselves. Creating more spaces for women and girls to talk up more about personal issues. We need to do that more so that the taboo issues, the issues around sex and HIV, can be more forthright and comfortable for us all as global citizens, so that we can really and truly start to deal with the issues that we're battling with forever and ever. So that's what we need to do. Recognizing that our girls and our women still have huge challenges when it comes to HIV, being impacted or infected with HIV, and that it's also essential and important for all organizations, whether civil society organization, the government, international development partners in whatever country you are, whether it's global north or global south, or whatever titles we have in development world now, that at the end of the day, our women and girls are still being marginalized. And no matter how we coin our phrases around who is key population versus marginalized, our women and girls should always be at the center, should always be at the heart. And based on the world is the theme, I'll end with this. We need to show more love and compassion and give and allow people living with HIV to feel dignified, including our women and girls. We're doing a bad problem with this. We have a huge problem with this, and we're not doing a good job, especially in my own home country of Jamaica. And so as an advocate, as somebody who leads an organization that serves people living with HIV, I want to be held accountable to ensure that I'm allowing the space, I am giving the voices, I'm doing the work, the programmatic work, etc., so that at the end of the day, my women and my girls, my key population, people living with and affected with HIV, are dignified and respected.
Wow. I think we should go home now. But I thank you so much for that. As a woman, I feel loved. I feel blessed by you, Jamoki. And I'm so happy that you joined us this morning for this conversation. Bless you. Tessie, your final thoughts. Women and girls, smart women, healthy choices in a space where we have global solidarity and shared responsibility for HIV.
Yes, for me, smart women, healthy choices. I like to come from the frame point or mindset of working with women who are living with HIV. I have had the pleasure in working with them. And one thing that I can honestly say that I have been able to take away is listening to them. They have really been able to make some healthy choices as it relates to also being advocates and bringing other women in, and also wanting to educate young girls. Earlier, I made reference about positive voices, and it was a support group that my agency was able to host. And positive voices stand for proactive, optimistic, sisters in touch, involved, validated, and empowered. Those women were able to even show me how to be one to advocate for my own health. And so when we find women who are smart enough to be able to educate other women who are not HIV positive, but how to know about going about being able to talk about their own health and make those healthy choices moving forward. So one thing that I am really pleased about as well is all the information that has been shared this far. It lets me know that there are other states as well as countries who are doing some of the same things that we are doing in the Midlands at our agency. And the fact that, smart women, we are that. We are that. We are smart women.
Thank you very much. And I like what you just said, and I'm going to take this opportunity. You see, in Jamaica, we say you must put mic in front of people, all right? Because they're going to give shout out. So I want to give a shout out at this time, because I know I've seen online in this chat, the E for Life mentor moms, smart women who are on the ground supporting their peers, giving information, doing the advocacy. So I want to give shout out to all of you who are in here, because you are definitely smart women. And like Tessie said, providing peer support and empowering other people. So sending some love to my E for Life smart women. Thank you. Um, Nakeitra, your last words in this section. Smart women, healthy choices in a global pandemic.
Ooh, global pandemic, yeah. But I think I will say what I always say in my work is I leave people with now you know. When you know, you have a responsibility. If we don't know, we can't act. But when you know, you have a responsibility to share that with someone else. And so, in knowing that, or knowing and having that responsibility, I say one, be comfortable with creating safe spaces within wherever your work is. We represent a lot of different sectors, a lot of different areas of work, and there's always an opportunity to intervene with someone in some way. And so be able to be that person that you can create that safe space for, or whether it's in a group like Sora Radford said, whether it's in Delta Gyms, Delta Academy, or whatever you're doing, create that space for people and women to feel comfortable talking. Know the resources in your community, because when you create that space, people will come and people will have questions. So know what resources you can connect them to, and know the great resources that will give them the care that they need in a very loving manner. And the last thing I'll say is continue to give grace. We are in some very troubling and hard times, and the decisions that people often make are based upon where they are and in their situation. And so we cannot judge people for what they're doing just for survival in this time now. So give grace and continue to just be supportive. And I just appreciate being on today.
Thank you. And my heart full, big, enough love. And as I check out of the role as moderator, I am very hopeful. I'm very thankful that we had this conversation. I want to thank the sorority. Our lives as an organization go way back. We have had so much support, and just to have this be a forum and a focus for us to have the conversation is another form and a way of the support. So I want to thank Joel and the team and everyone who has been a part of this. But from an E for Life, I want to thank you so much. We keep getting in different ways. And today we got in this way, and we're very grateful. When it comes to HIV in our world, I believe it's one of the things that we can actually put an end to. We are on our way. We're on our way with the medication. We're on our way with information. We're on our way with strategies. What we're not doing so well at is stigma and discrimination. And of course, leaving our women and girls behind. So as we move forward in global solidarity, I ask that all of us here in our own spaces ensure that we don't back down, but that we put forward the rights of women and girls to be and to be equal in every aspect, including receiving optimum HIV treatment and care. Thank you and namaste, and I hand you back over to Jules.
Joy, you are such a representation of your name. You did an outstanding job. I thank you so very much. I am so grateful for our sorors who charted this chapter and created this relationship with E for Life. So very thankful for that. And our panelists of speakers, good gracious, are you all outstanding. When I said the brightest minds, truly incredible contribution. Thank you all for that. We have our sorors from various chapters on with us. And I said earlier that when we decided to facilitate this program, when we put out the call, our sorors answered. And in answering, the Madison County Alumnae Chapter did just that. Their president, Kalia Brown, is with us. Soror Brown is with us, as well as their first vice, Dion Woody, is with us. So Soror Brown, if you'd like to share some remarks, I would love to hear from you at this particular time. Please open your.
Hello, everyone. I am Keela Brown Jones, the president of the Madison County, Mississippi Alumnae Chapter of Delta Sigma Theta Sorority Incorporated. Excuse my appearance. I'm in clinic, so I have been running between patients and the computer, but this has been a phenomenal forum. We must continue to have discussions surrounding HIV so that we can continue to bring awareness to this epidemic that we have been facing for many, many years. We're grateful for the opportunity to participate with our sisters of the Jamaica Alumnae Chapter. We want to continue to provide forums of this magnitude with our sorors who are internationally, because things that we are faced with in the States, individuals are also being faced with it internationally. As a provider, I'm an advocate for HIV screenings as a standard of care and continuing to educate our women and youth about the choices they make and how it impacts their lives. HIV has always been one of the subjects that people try to avoid. Actually, at my current clinic, screenings were very low when I started here, simply because the staff did not want to ask patients to be screened, and they felt like it was some type of violation to actually screen the patients when they were actually pricking their fingers for glucose screenings or hemoglobin A1C. So we have gotten really good with increasing our screenings. Here in Mississippi, the health department actually provides federally qualified health centers with free HIV screening kits. So we're able to do those free of charge in clinics. And with World AIDS Day just passing on December the 1st, we were able to actually go out into the community and provide screening. So as women, we are marginalized. However, with these type of discussions and forums, we can continue to bring awareness and stand in solidarity to help end the stigma of HIV. So kudos to the Jamaica Alumnae Chapter for putting together this awesome forum and allowing us to participate with you. The panelists, you were wonderful. And Mrs. Crawford, thank you for the phenomenal work that you're doing for women with HIV in Jamaica. So that's all that I have. And again, thank you for allowing us to participate with you all today.
Thank you so very much, Soror. I love you dearly, appreciate all of our sorors, the guests who were invited by our speakers, our panelists, those of you who saw the flyer about our partnership and decided to join us. There's so much work to be done, and I know that the work continues, but let us take a moment and applaud the work that has been done, the progress that has been made, and these soldiers who are on the line. These soldiers, Burse, Haywood, Crawford, and Patrick, kudos to all of you for the work that you're doing. Mr. Patrick, I think we all love you now. You got some sisters that's gonna put some love on you. So we appreciate your bravery and your honesty, such honesty in the things that you shared with us at this particular time. Please continue to follow the Jamaica Alumnae Chapter on our Facebook page. You may visit us online at dstjac.com. And of course, you can visit Delta Sigma Theta Sorority online as well. We are here to support, to help, and as we go into the holiday seasons, you all know that we have many people within this population that are going to be challenging in even extraordinary ways. So from what you've learned today, I hope you find more ways to support, to extend the learning, the education, and to advocate. It has been a pleasure to facilitate this program, facilitated by the Jamaica Alumnae Chapter, and we hope that you will continue to just be with us, partner with us, understand that we are strongly committed to the work that these organizations and so many else are doing. So at this time, thank you on behalf of all my sorors, our executive board, the members of our illustrious, incredible panel of speakers. If you have any more questions, please feel welcome to leave them in the chat and I will forward them to the speakers, or you may find them online and connect with them directly. God bless, stay safe, stay healthy, and stay in prayer. Take care.